Hi, Lunenburg. This is Jenna with Nashoba Associated Boards of Health. I'm your public health educator and communications specialist, and I'm here today with a fall health update brought to you by the Lunenburg Board of Health and prepared by Nashoba Associated Boards of Health. So today we're going to cover a few things that are relevant to health and wellness this time of year. First of all, we're going to talk about seasonal and respiratory illnesses like flu, COVID, RSV, and the common cold. We're also going to talk about ticks because, believe it or not, that is still a relevant topic. And we're also going to talk a little bit about winter emergency preparedness. So let's start with flu. Everybody knows about influenza, right? It's a disease of the respiratory system caused by a virus. It's always around. We just tend to see more of it in the fall and the winter, along with other seasonal respiratory illnesses. It occurs every winter season, beginning in fall and lasting through March. Common symptoms may include fever, cough, and sore throat, while other symptoms may include body aches, chills, headache, runny nose, and fatigue. So, like COVID, flu actually used to be a pandemic. That means it's a more severe form of illness that's very transmissible. Nowadays, we have more tools in our toolbox. Flu is endemic, which is the direction we're heading with COVID as well. Most people who get sick with flu will have mild illness. However, flu can make chronic health problems like heart disease, asthma, and diabetes worse. And every year, flu puts hundreds of thousands of people in the hospital. Next, we're going to talk about respiratory syncytial virus, which you probably know better by RSV. It's a common respiratory virus that usually causes mild cold-like symptoms, and it's most common in children and infants. Symptoms usually include runny nose, decreased appetite, coughing, sneezing, fever, and wheezing. We're seeing a trend of increase in the winter, suggesting a seasonal occurrence of RSV, which we have been kind of keeping tabs on since before the COVID pandemic. And it can cause serious illness in infants, young children, and we're also seeing it in older adults as well. So we have some new prevention tools in our toolbox related to RSV. So there are some new vaccines available for older adults and pregnant women. Monoclonal antibodies are available for infants and children at an increased risk of severe disease as well. And it's important to talk to your doctor about the right path for you, your loved one, or your child when considering any of these treatments or vaccines. All right, COVID-19. What we all know about COVID-19, it's an illness caused by the SARS-CoV-2 virus, highly transmissible. The symptoms appear 2 to 14 days after exposure. The symptoms may include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of sense of taste or smell, sore throat, congestion or runny nose, nausea and vomiting, and diarrhea. Reported illness range from mild symptoms to severe illness and death for confirmed COVID-19 cases. So what's new with COVID-19? We're learning to live with it a lot like we have with flu, as previously mentioned. And last month, the CDC updated their COVID-19 vaccination recommendations for fall 2023 and winter 2024. The CDC recommends that everyone ages 6 months and older get one updated vaccine dose. You have had the updated COVID vaccine if you had had a dose after September 12th of 2023. Updated vaccines are shipping out regularly and will be available at clinics, pharmacies, and other locations. Once providers receive the updated vaccines, you'll be able to search for appointments at vaccines.gov online, and local community clinics can be seen on mass.gov/mobilevax, MOBILEVAX. So the good news is anyone aged 5 years and over only needs one dose of that updated COVID vaccine, even if they've never been vaccinated before, to be up to date. We're not calling these vaccines boosters anymore. Another thing that's new with COVID-19, we have another available round of up to 4 free at-home COVID tests per household as of September 25th of 2023. You can order those on covidtests.gov. So now we're going to cover rhinovirus and enterovirus, which are a couple of bugs that cause what we know as the common cold. Common colds are the main reason kids miss school and adults miss work. Typically, these illnesses will last from 7 to 10 days. So rhinovirus is the usual culprit of the common cold. We might see sore throat, runny nose, coughing, sneezing, headaches, and body aches. And then enterovirus usually causes mild illness, very like the common cold. Fever, runny nose, sneezing, cough, skin rash, mouth blisters, body and muscle aches are all common symptoms, and many people are totally asymptomatic. So let's quickly review some of the tools in our toolbox for respiratory illness season. So it's important to practice good hand hygiene. Cover your coughs and sneezes with an elbow, not a hand, and this helps us prevent the spread of germs. You also want to make sure you're washing your hands really well with soap and water for at least 20 seconds. If you need a timer, you can sing the happy birthday song a couple times over. Vaccines are another tool in our toolbox to prevent the spread of illness and prevent ourselves from becoming really, really sick. Masking is always an option. Staying away from others when you're feeling sick so that you don't spread your germs to others. In particular, it's really important for healthcare providers, childcare providers, and staff at long-term care facilities to stay home and not go to work when they have fever or symptoms of respiratory infection to reduce the spread to vulnerable populations. It's really important to know your personal risk profile and the community levels of respiratory illness and act accordingly during respiratory illness season. For different people, depending on their personal risk profile, some of those actions might include antibody treatments, if appropriate, as well as masking or staying away from others when sick or when there's a particular threat of illness if you're immunocompromised or immunosuppressed. And one other tool in our toolbox is, of course, COVID-19 tests. You can use these anytime you're feeling sick to see if the illness you're experiencing is COVID-19. So in terms of keeping an eye on the community levels, we have some new tools in Massachusetts. The Massachusetts Department of Public Health has recently released a respiratory illness reporting dashboard, which includes data on hospital admission and emergency department visits related to acute respiratory diseases such as COVID-19, flu, and RSV. And all of these dashboards are updated once a week on Thursdays. So that's a great one-stop shop to visit and make some determinations about your personal risk profile and your community risk to determine your actions. The link is here on this slide. It's also important to take care of yourself if you're sick. So self-care for seasonal illness includes hydration, eating nutritious food, getting plenty of rest, of course using over-the-counter medications for symptom relief as appropriate. Always, always, always talk to your doctor if something doesn't seem right. All right, we're gonna switch gears and talk about ticks a little bit. Believe it or not, it's still relevant this time of year. They can be out any time that temperatures are above freezing, and with climate change, we can likely expect more tick-friendly temperatures in the fall and winter, so it's always good to be prepared. As you probably know, ticks are tiny bugs that feed on the blood of animals. They live in shady, damp places like brush, dead leaves, woods, and tall grass. Both adult and nymph, which are young ticks, can bite and spread disease. There are two common types of ticks in the north-central region of Massachusetts, the dog tick and the deer tick, which is also known as the black-legged tick. Deer ticks are very small. Nymphs are about the size of a poppy seed. So one of Nashoba's public health nurses may reach out to you to see how you are doing and ensure you're getting appropriate treatment if they get word from your doctor that you've tested positive for a tick-borne disease. When they're conducting this type of outreach, they're tracking the spread of communicable disease, making sure that you're staying healthy, and educating the public about prevention to try to keep our communities as healthy as possible. It's important if you are bit by a tick to monitor the area and make sure that there aren't any changes. And if you're seeing anything that you're not happy with, contact your healthcare provider. To prevent ticks, stay on main pathways in the center of a trail when hiking, wear long sleeves, light colors, and pants tucked into your socks. Use insect repellents, and check yourself, kids, and pets for ticks daily. If you found a tick, don't panic. Use fine-tipped tweezers to grip the tick as close to the skin as possible and pull straight out with no twisting. Switching gears once again to winter emergency preparedness. To prepare for emergencies at any time of year, you want to make a plan, build a kit, and stay informed. So making and having a plan, you can do this and get some guidance for building a kit as well on this website, mass.gov, Be Prepared for Emergencies. This will guide you through making a kit at home and also having a plan in place for yourself and your loved ones in case of an emergency. Staying informed is also important, and you can subscribe to get alerts on the Lunenburg Town website. You want to hover over How Do I on the main page and click Alerts under the Sign Up For category, and then follow the instructions to subscribe to the Town of Lunenburg's alerts. Some particular considerations for emergency preparedness in the winter include weatherproofing your home to protect against the cold, insulating walls and the attic, caulking and weather stripping doors and windows, installing smoke detectors and carbon monoxide detectors, and this is important, making sure that the batteries are working in those. Have your chimney inspected annually, and never leave lit candles or other flames unattended. Prepare yourself, family, and pets for winter weather exposure. Dress warmly with layers to prevent frostbite, and limit exposure to the cold, as well as dampness to prevent hypothermia. Make sure your car is ready for winter weather travel. Check antifreeze levels and have radiator systems serviced, replace worn tires and check tire pressure, and keep your gas tank full. If power lines are down, call your local utility and emergency services. If power lines fall on your car, warn other people not to touch the car or power lines and contact emergency services. As a quick reminder, Nashoba Associated Boards of Health is your regional board of health, serving the local elected boards of health in 16 towns in the north central Massachusetts region. You can access more information regarding a number of public health related topics through our website resources page, www.nashoba.org/resources. Thanks for watching, Lunenburg, and we'll see you next time. Stay healthy.